Okay, so good day to everyone. We are here to present our chosen study, either qualitative research or quantitative research ba yung pipiliin namin. But since we chose the qualitative research, dito kami magbe-base sa study namin. So we've been instructed by our professor na gawa daw kami ng 15-minute group report. So we decided to create a PowerPoint presentation for our chosen study. So here, our research is all about qualitative research. Now let's proceed. Okay. So for our qualitative research, we have here our study, number 1. Number 2 is our study purpose. Number 3 is the study methods. Number 4 is key findings. And number 5 is conclusions. But before mag-proceed kami sa mga pag-report ng mga assigned parts namin, okay, let's have a brief description first sa mga instructions or guidelines na binigay ni sir. So number 1, we have here our study. So the study that our qualitative research is pertaining to is all about living with risk, mothering a child with food-induced anaphylaxis. So we have here Gillespie or Gillespie. I don't know how this is pronounced, but I think it's Gillespie et al. In year 2007. Number 2 is we have the study purpose. So it means, ano ba yung purpose ng study namin? So the purpose of this study was to develop a narrative description of the underlying meaning of mother's lived experience of parenting a child with food-induced anaphylaxis. So since ang research namin is all about qualitative, it's more of a narrative description. Next is number 3, study methods. So our study methods contains 6 mothers of children 6 to 12 years of age who were considered at risk for food-induced anaphylaxis were recruited to participate in the study. The number and type of food allergies varied, but peanut was the 28 assistance for consumers of nursing research most common. 2 in-depth interviews, each lasting 1.5 to 2 hours, were conducted with each mother in her own home. The interviews, which were audio taped and then transcribed, focused on what it was like for the mothers to have a child with life-threatening food allergy. So yun yung study methods namin. Number 4 is our key findings. In our key findings, we have here living with risk. So naka-quotation siya, was identified as the essence of the mother's experience and was supported by 5 themes. So these 5 themes, we have number 1, living with fear. Number 2, worrying about well-being. Number 3, looking for control. Number 4, relying on resources. And number 5, it is hard but it is not. Each theme was supported with rich narrative descriptions from the in-depth interviews. So yun yung study namin sa qualitative research. Meron kaming study, study purpose, study methods, key findings, and conclusion. So here is our conclusion. Ang conclusion ng study namin is we have the researchers concluded that the themes describing mothers' fears and concerns would be useful in assisting nurses to meet families' education and support needs related to food-induced anaphylaxis. Now let's proceed. The group report should be able to answer the following questions na provide ni Sir Rodney. So number 1, the question is, how relevant is the research problem in this report to the actual practice of nursing? Does the study focus on a topic that is a priority area for nursing research? So that's the question for our number 1. So the answer will be reported by Miss Jasmine Soriano.
Thank you, Ms. Lispo. So the question number 1 is, how relevant is the research problem in this report to the actual practice of nursing? Does the study focus on a topic that is a priority area for nursing research? So, the relevance of the research problem in this report is how this mother lived experience in parenting a child with food-induced anaphylaxis, or FIA, can be able to understand and cope up with the situation, as many research studies suggest that it affects an increasing number of children and families encountered in a variety of nursing environments. FIA is a serious medical event, and managing it can place tremendous mental, emotional, and financial burdens on parents of children with IFA. So, ang prevalence of food allergy ay tumataas in recent years, particularly sa mga bata. Ang food allergy ay maaaring magresulta into life-threatening anaphylaxis and impose a personal and public health burden, which can increase health-related costs. So, may mga clinical management includes short-term intervention to make acute reaction and long-term strategies to minimize the risk of further reactions.
So the next second statement or second sentence will be continued by Mr. John Paulo Caldito.
Yeah, so in this stanza, through nursing approach, nurses will provide specific strategies for the parents to employ in minimizing the impact of food allergies on the child's and the family's life. These strategies influence parents' ability to increase their competency by minimizing risk and enhancing the safety of the children's environment. Therefore, the study focuses on priority for the nursing research because it reflects nursing commitment to the promotion of health and healthy lifestyle and advancement of quality and excellence in healthcare and critical importance of basing professional nurses practice on research. So yeah.
Okay. So thank you for that, Ms. Jasmine Soriano and Mr. John Paulo Caldito. So the second question is all about what is the underlying purpose or purposes of the study. So pag-uusapan natin dito yung identification, description, exploration, explanation, or prediction and control. Does the purpose correspond to an evidence-based practice, focus such as treatment, diagnosis, prevention of harm, etiology, or meaning? So we have here the next part will be reported by Mr. Rai Zaratan.
So, identification. What is this phenomenon? What is its name? With regards to the study, the given topic is pertaining to mothers who have children with 6 to 12 years old of age who were considered at risk for food-induced anaphylaxis. So, about to sa mga mothers na may anak na 6 to 12 years old na may food-induced anaphylaxis. The name of the study was titled Living with Risk, Mothering a Child with Food-Induced Anaphylaxis, which refers to serious allergic reaction due to the ingestion of a specific type of food. So, example ng mga foods na ito is yung peanuts, tree nuts, milk, egg, sesame seeds, and fish and shellfish. So, yan. In this case, we can be able to identify here the mother's lived experiences of parenting a child with FIA. Also, to describe how does it feel to have a child who suffers with food-induced anaphylaxis in order to develop a narrative description of the underlying meaning of mother's lived experience of parenting a child with FIA. Yun lang.
Okay, so thank you for that, Mr. Rai Zaratan. So the next part in our number 2, still under number 2 pa rin tayo, we have the description to be reported by Mr. Mark Jonathan Soriano.
So hello. So in description, what we did here is that we didn't just choose one type of purpose. We tried to connect this study to every type of research purpose which is applicable for qualitative research in this particular topic. So hindi na kami basta pumilit ng isa, which is identify or description. Kinonect namin siya sa lahat ng purpose or type ng purpose para mas maging informative yung aming report. So in description, there are two also questions. What are the dimensions of the phenomenon? What is important about the phenomenon? Now the answer is a total of 6 mothers with children of 6 to 12 years old of age participated in the said study. Therefore, the dimensions of the phenomenon that were given include 2 depth interviews, each lasting 1.5 to 2 hours, where it will be conducted with each mother in her own home. The importance of this phenomenon is to explore the perspectives of the mothers individually in order to recognize their ideas and personal thoughts on the situation, along with the number and type of foods that causes allergic reaction to their children. So, now if we go back to our given study, which is yung given na nilagay ni Sir Ronnie, the research purpose was already stated, and then we can easily determine the main purpose of the study. So, basahin natin yung given. Study purpose. The purpose of this study was to develop a narrative description of the underlying meaning of mother's lived experience of parenting a child with food-induced anaphylaxis. From the word itself, narrative description, which is very connected siya sa description type of study. Now in this study, the phenomenon is being described by the participants, which is the mother's lived experience of parenting a child with food-induced anaphylaxis. So meaning nga ng description, describe, ina-explain dito ng mga mothers kung ano yung nararamdaman nila. So next, let's try to analyze the question under the descriptive purpose. So yung binasa ko kanina, what are the dimensions of the phenomenon? So the word dimensions, if ginugol natin siya, may a measurable extent of some kind such as length, depth, or height. So pag sinabi natin yung mga bagay na to, ang pumapasok sa isip natin is yung numbers, which hindi naman talaga nag-a-apply sa isang qualitative research. Pero kapag tignan natin yung isang meaning ay yung ibang meaning ng word dimension, it means an aspect or feature of a situation, problem, or thing. And ditong mga bagay na to, makikita natin siya sa example ng mga key findings and the conclusions which is given na sa this type of sa example ng ating study. So next reporter po.
Okay, thank you for that, Mr. Mark Jonathan Soriano. So next part will be reported by me. So it's all about exploration naman tayo. So the 3 questions that corresponds to this exploration is we have what is the full nature of the phenomenon? What is really going on here? And what is the process by which the phenomenon evolves or is experienced? So, we're talking about here kung ano yung overall nature ng mismong situation ng study natin, ano yung mismong process na nangyayari na kung saan merong evolving and experiences na talagang nangyayari. So, ang answer namin for that is we have the overall nature of the phenomenon based on the study is for us researchers to have a better understanding how food-induced anaphylaxis affects mothers in parenting their children during the situation. So ayan, in this part of our study, mas mag-gain ng understanding kaming mga researchers kung paano nga ba talaga nakaka-apekto yung food-induced anaphylaxis. So when we say food-induced anaphylaxis kasi, we are talking about the severe allergic reaction ng isang individual when it comes to a particular type of food. Okay, so we also have here, it says here, including the causes, factors, risk, and variation in the amount or type of food that triggers allergic reaction to children age 6 to 12 years old in order to identify the potential problems. The method used for this study is through interviews which were done through audio tape and then transcribed in order to focus on what it was like for the mothers to have a child with a life-threatening food allergy. Ang food allergy kasi pwedeng either acute siya or life-threatening. So yung buong process na nangyari dito sa study namin is kinonduct nga siya, which is through interview, 2-depth interviews na ginamitan ng audio tape. So, doon in-interview yung mga mothers individually in their homes. So, continuation for that will be reported by Miss Francesca Marin.
The process by which the phenomenon evolves or is experienced was mainly because of the living with risk idea, wherein it contributes to the essence of mothers' lived experiences, which were supported by 5 themes. The first is living with fear. Second is worrying about well-being. Third, looking for control. And fourth, relying on resources. And the last one is, it is hard, but it is not. These themes serve as supporting evidence on why the phenomenon still evolves and experienced. Well, of course, as a mother, you tend to be worried by everything your child does or eats or basically anything they do. Kasi ang mga nanay natin is meron silang maternal instinct. Siyempre, natural lang yung reaction nilang ganun. Pero, ibahin natin ang mga batang merong food-induced anaphylaxis. Because food-induced anaphylaxis may be fatal when not treated or prevented. These lived experiences of mothers who are living with risk with children who have food-induced anaphylaxis serve as evidence to our study, and it is actually still being experienced by mothers all over the world. So,
Okay, thank you for that, Miss Francesca Ann Marin. And the next one is we have the prediction and control. But since there is no corresponding here, based dun sa PowerPoint ni Sir Rodney, if you're watching this right now, sir, wala po kaming nakitang corresponding question. So therefore, we did not put anything under the prediction and control. Now let's proceed to explanation. So the question is, how does the phenomenon work? Why does the phenomenon exist? And what does the phenomenon mean? And how did the phenomenon occur? So particularly, pinag-uusapan natin dito kung paano nag-exist yung situation. So this will be reported by Miss Rochelle Cruz.
Hello, everyone. The question here is, how does the phenomenon work? And why does the phenomenon exist? It says here that a food allergy is an abnormal response of the body to a certain food. Food allergy causes an immune system response, causing symptoms in your child that range from uncomfortable to life-threatening. And what does the phenomenon mean, and how did the phenomenon occur? It says here that before having a food allergy reaction, a sensitive child must have been exposed to the food at least once before, or could also be sensitized through breast milk. It is the second time your child eats the food that the allergic symptoms happen. And at that time, when IgE antibodies react with the food, histamine are released, which can cause your child to experience hives, asthma, itching in the mouth, trouble breathing, stomach pains, vomiting, and ordeal within the minutes to an hour after digesting the food. Yung explanation nasabi naman na lahat, pero I just want to clear what is the meaning of phenomenon. It is a scientific context. It is something that is observed to occur or to exist. And in this study, the meaning contrast with the understanding is the extraordinary or outstanding. The phenomenon may be originate in either the practical world of affairs or a theoretical discipline or a personal experience or insight. Thank you po. Next report.
Okay, so thank you for that, Ms. Rochella. And we have here an additional statement that ako na lang magbabasa. So it says here, approximately 90% of all food allergies are caused by the following 8 foods. So 8 foods usually ang common cause kung bakit nagkakaroon ng food allergies ang bata. And these 8 foods, we have here the milk, eggs, wheat, soy, tree nuts, peanuts, fish, and shellfish. And di ba, if you can still remember, meron ding tanong na nagko-correspond dito if naka-based ba siya sa isang evidence-based practice. So we have concluded here na the assistance for consumers of nursing research was found out that peanut was the 28th most common cause of food-induced anaphylaxis. This clearly proves that the purpose of the study corresponds to an evidence-based practice focused as a part of diagnosis. Okay, the third question is all about, is this study fundamentally cost-probing? So when we say fundamentally cost-probing, yung study ba is mayroon ba siyang mga underlying causes kung bakit nag-o-occur yung mismong phenomenon natin? So that will be reported by Mr. Christopher James Llamas for the first sentence.
Our answer in this question is yes. The number and type of food allergies varied, which may cause death rapidly even on healthy individuals. This condition is known to be a sudden and potentially life-threatening allergic reaction, which involves at least two organ systems and a sudden drop in a blood pressure. It can be acute or life-threatening systemic reaction with varied clinical presentation and severity. So in this statement, identifying anaphylaxis as soon as it starts is important. When exposed to a known allergen, involvement of two or more systems of the body necessitates immediate treatment. Proper management in the healthcare begins with appropriate diagnosis or food allergy so that the patient can be instructed on specifically which food can trigger allergic symptoms. So there are systems of the body are involved, which is the cutaneous, respiratory, and cardiovascular, and gastrointestinal system. So in anaphylactic skin or anaphylaxis, um, related doon yung cutaneous, which is the skin that may start out as itchiness, redness, or mild warming of the skin. So the next system that involved is the respiratory system. So the uh, the involved of the respiratory system, which is uh, constriction of the airway leading to difficulty of breathing, and swelling of the throat may be blocked the airway in severe cases. That's why anaphylaxis can be a life-threatening. And the next system is the cardiovascular system. During anaphylaxis, small blood vessels or capillaries begin to leak blood into your tissues. This can cause a sudden dramatic drop in blood pressure. Other symptoms include a rapid weak pulse and heart palpitation. Next and last system that are involved in anaphylaxis, which is the gastrointestinal system. The symptoms in anaphylaxis is such as severe abdominal pain, vomiting, and diarrhea. May also occur histamines and the substance released by the body during an allergic reaction. That's all.
Okay, thank you, Mr. Christopher James Llamas. So the next sentence will be yours, Mr. Austin Chan.
This is because it results to assess a systemic release of mediators from mast cells and basophils. The diagnosis of FIA is based on a combination of medical history and presence of IgE or immunoglobulin E to the responsible food. In general, the more rapid the onset of symptoms following exposure to the allergen, the more likely the reaction will be severe and life-threatening. So to summarize this statement, kung gaano po kabilis lumabas yung symptoms dun sa na-take nung child na food, ganun din po ka-severe yung yung complications or maaari itong ikamatay. That's all po.
Okay, thank you, Mr. Austin Chan. Next, Patricia Antandok, continue.
Okay, so food-induced anaphylaxis can affect people of any age and with any food. Food-induced anaphylaxis that are common among teenagers and young adults with peanut and peanut allergies. For food-induced anaphylaxis, mortality is more likely in people who have both IgE-mediated food allergy and asthma. So food-induced anaphylaxis can really affect people and usually mga bata. According nga po sa interview po namin, we found out that peanuts and mga peanut daw ang nag-trigger allergies usually sa mga bata. Dun sa sa barangay na yan. And yeah, must be treated because it usually leads to death pag hindi nagapan. That's all.
Okay, thank you, Miss Patricia Antandok. Then our last question is all about what might be some clinical implications of this research. So when we say clinical implications, mga clinical suggestions that we can include in our study. So to what type of people and settings is the research most relevant? Kung kaninong specific group of people and setting mas relevant yung study namin. And if the findings are accurate, how might the results of the study be used by you? So let's proceed for the following answers by Miss Des Bigay.
So, the possible clinical implications that this study could provide is that nurses and other medical personnel would have better understanding on how to take care of children with FIA in a household setting. The findings will serve as a guide for the nurses so that they can provide the best assistance possible as well as the education that the family needs. Um, so in this way, it will be easier for the nurses and other medical personnel to educate family to draw on a dominant mem of risk avoidance as well as counter discourse of calculated risk taking.
Okay. So thank you, Miss Geraldine Desbigay. And then the next continuation para sa sagot namin sa number 4 is yours, Mr. Anton Villaflor.
To what type of people and settings is the research most relevant? The study is most relevant when it comes to parents, specifically mothers and children, or as a whole family, because it tackles the idea of living the everyday life of the correspondents. The setting wherein this study is most relevant is in hospital or in medical setting, because it introduces the way of living in a household of mothers with children who suffer FIA, which cannot be observed in a hospital setting. Due to this study, better understanding was attained by the medical field about the psychological and mental health of a mother with a said situation.
Okay. So, last one, our last statement namin for our number 4, the research is most relevant for assisting nurses to meet families' education and support needs related to food-induced anaphylaxis as stated in the conclusion of the study. If the findings are accurate, the nurses will understand the mother's experiences and the supporting themes. In that way, the nurses can help teach the mother how to cope and understand the situation they are in. So yun yung mga clinical implications ng study namin. Hindi lang siya relevant sa mga parents, particularly from mothers, but also to nurses. So it would not just give them a better understanding, but it would give them healthy interventions kung paano mag-cope up at kung paano yung gawin nila dun sa mga anak nila or dun sa mga children na age 6 to 12 years old na merong food-induced anaphylaxis. And that ends our report. So we have answered the following questions that were provided based sa instruction. So yun yung napili naming research, Sir Rodney. It's all about qualitative research. So we are the researchers. We have here Miss Geraldine Bigay, Miss John Paulo Caldito, Mr. Austin Chan, Miss Rochella Cruz, and Miss Dispo, Miss Marin, Mr. Llamas, Miss Soriano, and then another Mr. Soriano, and then Patricia Antandok, and then Mr. Anton Villaflor, and we have Mr. Patrick Raizaratan. Okay. So that ends our report, and thank you.